Good afternoon, Kershaw County School District, students, staff, and families. I wanted to provide you with an update on where we stand as a school district. First, let me say it's been very refreshing to see our students back in the buildings in force and the interaction and the things that are taking place in our schools. We know this continues to be trying times, and it's important for us all to remain optimistic and positive. The next generation is counting on us to lead them through this incredibly challenging time. Our goal is to remain as transparent as possible and to ensure we have real-time data to assist us in making decisions. Our current protocols, which were in part established by a 50-person task force, can be found on our website. Simply click the banner titled Return to School 2021-22. In this same location, you will be able to find a live interactive COVID-19 dashboard that shows in real time the number of students and staff by location who are either positive and in isolation or deemed a close contact and in quarantine. For those of you affected by children in quarantine, we truly understand the level of inconvenience and implore our community to assist us in our efforts to ensure we keep the number of excluded to a minimum. As I shared with our staff on day one, we must be ready to pivot, and only together can we win this fight. In the next few slides, I'm going to show you what we're doing as a school district and where we are in terms of fighting COVID-19 this school year. So what are we doing? This is a snapshot of the things that we're doing. Our complete response protocol can be found online at the following website URL. So in summary, we still continue to conduct temperature checks prior to entering a KCSD school. We are social distancing whenever and wherever possible in the buildings. Now that we have 99% of our students back, it does become increasingly difficult, but we are trying our best to do just that. We do daily sanitize our school buildings, our buses, and our athletic equipment. If we do have a classroom that has a positive case, then we go in and we do an extra thorough cleaning of that classroom or that area. We're teaching hand washing and respiratory etiquette. This is important to reduce disease transmission in general, not just COVID-19. There is hand cleaner at each front entry of our schools, in each classroom, the bathrooms, and we have hand washing stations in the cafeteria as well. We have comprehensive contact tracing and isolation and quarantine protocols that's being conducted by our administrators in each of the buildings as well as our school nurses. We have isolation rooms that are separate from our health offices for individuals displaying signs and symptoms of COVID-19. We have nurses in each of our buildings, and where appropriate or where available, we have health room assistants, and we're trying to increase that number daily. As it stands, we had stopped using bus assistants on our school buses to temp check students, but because of the increased surge in many of the communities around our state and country, we are reinitiating the use of bus assistants. We're doing our very best to maintain students in pods when possible. This is important because if there is a student that's identified as positive, it does reduce the number of students that have to be quarantined due to close contact. And we have altered our cafeteria seating protocols. In some cases, specifically the elementaries, we do have students that are rotating through eating in their classrooms. We're using either every other seat or in some cases every other table. We're using gymnasiums, multipurpose rooms. It is still quite hot in South Carolina, but at the high school level, we do have areas outside where students can eat, and we're doing the same with our elementary students as well, just on a limited capacity at this time. So I wanted to just show you a quick snapshot, and again, we'll post some of this on the website as well. But we've gone through every single one of our buildings and tried to do a safety audit to ensure that we're utilizing the layered risk mitigating strategies that our response protocol says we'll be doing. So in this, you can see pictures of how we are separating in the cafeterias. We're temp checking at the entry points of our buildings, and we're utilizing the plexiglass that we had initiated last year. We've purchased more plexiglass now that we have more students back on campus. So where we are not able to socially distance, we're using that extra layered mitigating strategy for our students. So where are we as a school district? First of all, this is like being on a roller coaster. Our numbers go up, our numbers go down, but we keep a very interactive, real-time track on our data. And this gives you, as of this filming on Thursday afternoon, a snapshot of where we are as a school district. So at the elementary level, we have 91 positive students, 543 in quarantine due to close contact. And I just want to make a statement that the close contact is not just close contact in our schools. A lot of the close contact tracing is close contact outside of the schools as well. And so we have 634 students that are now excluded either due to a positive diagnosis or quarantine scenario. At the middle school level, we have 96 positive cases, 327 in quarantine, and a total of 423 that are excluded due to these scenarios. And finally, at the high school level, we have 72 positive students, 317 in quarantine, and 389 that are excluded in our positive or quarantine protocols. So the total number of students in the Kershaw County School District, which currently has an enrollment of 10,892 students, we have 1,446 students that are not in a face-to-face environment due to one of these exclusion strategies that we're utilizing. The only positive point to this, and there's really nothing positive that you can say about the COVID-19 virus, is the number of positive students, and I understand one positive student is too many, but the number of positive students remains relatively low for the enrollment we have in our school district. A majority of our excluded students are excluded because they've been a close contact with either a fellow student, a family member, or somebody in the community. Another thing we're keeping a watchful eye on is our athletic COVID-19 tracing. Last year, that was a really big concern and issue for us. I believe that our high school, middle school athletic programs have done an amazing job, and we keep this updated about every 24 to 48 hours. The athletic directors go in and they work with their school nurses and they log real-time, up-to-date data. But you can see over here, and I'll just summarize this. We have it broken down by building, by fall sport. But in the comment section, the total number of high school athletes we have in the Kershaw County School District is 535. To date, we only have 6 positive student athletes, and we have 21 student athletes that are in quarantine at the high school level. I think those are really good numbers. At the middle school level, we have 222 total athletes. We have 7 positive middle school athletes and 37 middle school athletes that are in quarantine. So again, 1 is too many, totally understand that, but when you look at the complexity of our community, I think that we are mitigating risk really well in what can be sometimes a very interactive activity like our fall sports programs. The last thing I wanted to share with you is some just relevant website data I think that you can find useful. COVID testing resources, we've tried to capture that on our website so you can find a location close to you if you need to go and you need to have you, yourself, a family member tested for COVID-19. It also gives you locations where the vaccination is being provided. I will tell you also a shout out to the Kershaw County School District nurses. Over the last 6 months, we have conducted 5 vaccination clinics, and we have provided our community over 2,000 vaccinations in response to this pandemic. And I'm very proud of their efforts in that. You can also go to our website and you can find our response protocol, unabridged response protocol. Just simply click on this link or type it in your URL and it'll give you the entire plan. I felt it'd be useful for you to see what DHEC's updated guidance and some of the literature they have. And then finally, the CDC. And just in closing, I want to just say thank you. We are doing everything we can to ensure that our students are receiving a face-to-face instruction in the safest, healthiest environment possible. It's not easy, but only together can we get this accomplished. I believe our community is doing it as well, if not better than most, and we'll continue to amend our protocols and address the needs of our community and our students to make sure that we can continue to do this throughout the rest of the school year. So again, we do appreciate all the support you give us, and we're trying to do our very best for your children. Thank you and have a great afternoon.